All right, so we're going to try our line to Dr Jeremy Nel once more, infectious disease expert at Wits University. Dr Nel, can you hear me?
I can hear you. Can you hear me?
I am delighted to tell you that I can now hear you. So let's proceed. And of course, we're just looking at the latest COVID numbers that have come in, 7,500 new infections. KwaZulu-Natal now has the highest number, followed by Western Cape and then Gauteng. But it's the deaths in this past cycle that are really alarming. 573 deaths in the past cycle. That is really high. What is going on? Is it something to do with what's happening in our hospitals that it's so high? Or is this what you would have expected at this point in the third wave?
It's a great question, and it's important to realize that the deaths lag the cases. In other words, if you get diagnosed today, for those very few people who do get sick and do end up in hospital, that may happen a week later, and then a death if it occurs a week after that. So we always expect the peak death rate to occur a week or two, closer to 2 weeks after the peak infection rate. And I think what's driving a lot of these deaths, and remember, many of these deaths are not being counted as COVID deaths because people are, for example, not testing or even succumbing at home before getting to hospital. So the excess death rates are even higher than the actual death rates that we're seeing. But what's driving a lot of this in many centres is just the overwhelming number of cases on the healthcare system. And we saw it in Gauteng, where I work, where it was absolutely disastrous in many settings because of the enormous numbers of patients. And we're seeing it in other provinces which have been hit hard. Some of the provinces have got away relatively lightly this wave, but others like Gauteng and Western Cape and to some degree KwaZulu-Natal are being overwhelmed at the moment.
What about the level of hospital care? You know, we know that disturbing story about Helen Joseph Hospital where a young woman died in a wheelchair waiting for care, and the allegations are that no one actually noticed. Also some disturbing anecdotal stories of wrong medication being given out even in private hospitals, nurses not doing what they should to look after COVID patients, and crucially, many times it's family and friends who would visit someone in hospital who pick up that the person is being neglected. That, of course, cannot happen in a COVID ward. Surely that makes patients even more vulnerable.
It does. And of course, I mean, I don't know the specifics about individual cases, but it's certainly true that many more problems occurred in this wave where hospital systems were overwhelmed. You know, if people are sitting in the emergency department for days on end without a ward bed, for example, as occurred in many hospitals, and if people are struggling to get the attention of medical practitioners, even to get into hospital in some cases because of the overwhelmed ambulance services, these sort of issues are going to crop up. And it's really a symptom of the healthcare system being overwhelmed. And the big thing to avoid, of course, going forward, by all means, because this is the vaccination's job. If we vaccinate enough people, this is what we aim to prevent.
Absolutely.
And to date, it has not been done.
I want to speak to you about which provinces are over the third wave. We know that Gauteng is. It looks like the Western Cape is on 1,700 infections. KwaZulu-Natal, of course, is now topping the list with 1,979. Is KwaZulu-Natal still heading for its peak? And the Western Cape, where are things at exactly?
Most provinces appear to be over the peak at the moment. Western Cape is still going up, although there's some early evidence it may be roughly at the peak around now. It'll take time to know if that early trajectory's actually changed. Interestingly, KwaZulu-Natal doesn't appear like it's going up hugely at the moment, even though it's leading the cases today. But of course, there's a number of issues in KwaZulu-Natal with the amount of social unrest that's happened recently, especially there, that's impacted on the number of testing. So it's quite erratic at the moment in KwaZulu-Natal in terms of knowing what's going on. It's quite possible that all the social unrest and the issues that came with that may lead to excess cases. But for the most part, with the exception of Western Cape and maybe the Northern Cape, most of the provinces at least appear to be over the wave based on the current figures. And the big thing, of course, is avoiding this in the next wave.
Yeah, absolutely. Vaccine hesitancy, it's something that's much discussed. We know that the older you are, the more at risk you are with this virus. How much of a problem is vaccine hesitancy still? I'm getting a sense maybe not as much now that we're all seeing friends and family going for the vaccinations. What do you think?
Yeah, I think that's a really good point because it is a moving target. I think that's been reflected across the world, that the numbers you see in terms of when you take polls in terms of people who are definitely going to get it or definitely not going to get it or undecided, they fluctuate a lot with time. And one of the big drivers of moving people from hesitancy into actually accepting vaccine and willing to take one is knowing friends and family members and sometimes public figures who've had it. So I think that what you're seeing with the expansion of the vaccine program is a lot of people who are on the border have decided to come across and get a vaccine, which is something obviously I would endorse. And I think we need as many people as possible. I do think, though, that what we're seeing now with the relatively good numbers that are coming out every day, sometimes last week and the week before, even over 200,000 new vaccines were given in a day. I think that's the low-hanging fruit in the sense because we've just decreased the barrier to vaccination in terms of age. You're getting a lot of very keen people. But I think to capture the back half, say, of those people who are somewhat undecided or just find it very difficult to get to a vaccination station, that'll take a lot of work from the government and from other organizations to really get as many people vaccinated as possible.
Yeah, that's so very true. And also a lot of communication and a lot of interaction to calm those fears of people who are somewhat hesitant. Thank you so much for chatting to us this evening. That was Dr. Jeremy Nel, an infectious disease specialist at Wits University.